Good morning. I'm Doug Evans, the President and CEO of the Palm Beach Chamber of Commerce, and you are here for your Palm Beach Guide. And we always come together to come up with great, interesting things in our audiences and things happening here in town, in the region, around and about. And today is no difference. And I will tell you, I'd heard the name of this organization at one point in time. I've been here a long time, but I didn't know a whole lot about them. And of course, they're a chamber member, a chamber sponsor, and they do incredible things here in the community and are also making great strides as far as the expansion of the organization. In today's day and age, of course, there's a lot of talk about mental health and mental health issues, and a lot of times people are afraid to reach out for what that will feel in their psyche or their professional career or something. And to have Dr. Docekal, who is the president, CEO, grand leader of the Hailey Center and the Hailey Foundation, and I've got to tell you, Dr. Docekal, I've heard a lot about the Hailey Foundation and the Hailey Center for a long, long time. You made a presentation as a center to our chamber about a year ago about January being Mental Health Month and the month where suicides occur.
Mhm.
And you have programs to go into the community, the corporation. So welcome. So
We
glad
do.
you're here with us.
We
Thank you
do.
for joining us today.
Doug,
And,
thank you.
and
And it's Rachel.
it's Rachel. Okay,
Yes,
Rachel, thank
yes,
you so
yes.
much. I love what you folks do because you have taken the word I was looking for. You've taken the stigma away from mental health issues. So you were the CEO of the Hailey Center at one point in time.
I was.
And you came back. So tell me about you a little bit, your career, and what's happening at the Hailey Center and your vision for the future of the organization.
Sure. Well, you're right. I was the CEO from 2010 through 2014. And at that point, I looked around and I was doing all this work for organizations as a favor to my friends, CEO here, CEO there. Rachel, can you come in and do this or that? So I started a consulting firm, and Hailey Foundation was my first client.
Oh my gosh.
They were my client the entire time. And in 2023, the board asked if I would consider coming back as the CEO. And it took a little bit. There was a little bit of foot dragging, but eventually I said, if we can do something really big in the behavioral health field, I'm willing to come back and I want to come back. So I did.
So you have all those clients that you were working with, and they're sitting there probably prostrate with grief now that you're not helping them. But you're right, really, really big things. And I was at a dinner last week where we talked about the expansion of this community,
Mhm.
the amount of people moving here in a
Yes.
variety of industries, which would infer to me that there could be an increase in client load
Mm.
for the center.
Mhm.
And you talked about really big things with the center. So tell me about, you said to them, which is what I did also, by the way, here's where we need to go with this organization. Every job I've ever had, and we both feel that same way. Talk about your vision for the future and some of the things you think that you can talk about that are not top secret,
Sure.
that you think need to be addressed in this community, that
Sure.
perhaps aren't, because you fill a very important space in this community, this region actually. So talk about that and also your vision for the future and the needs of the community.
Thank you. Hailey Foundation is the largest continuum for behavioral health in the world. We are the only organization that is doing everything from evidence-based youth prevention with kids as young as elementary age, all the way through treatment for mental health as well as substance use disorders. The fact that we are right here in South Florida is such a gift as this community continues to grow. You're right. We have seen a huge uptick in mental health. A lot of it is tracked back to the pandemic, but
Oh.
what we think at Hailey is that it tracks back to smartphones and then really when Facebook deployed. So social media and all of those different platforms that came online in the early 2000s, and kids specifically starting to use those and redefining what connection means. So instead of connecting like you and I are, where we're sitting down and we're having a cup of tea and we are talking about issues, kids are looking at these snapshots that are made to look amazing of other people's lives. What we call them are really those favorite reels. So they get online, they take a look at something that is romanticized or is made to look beautiful or incredible, and they think, why don't I have that? Or they see a picture of, other young people together at a party or out to a movie, and they think, why was I not invited? And instead of being present with their friends and their family, they are instead online. And it really has devastated mental health.
Yeah, to me, that's fascinating because, I have social media accounts
Hmm.
and I see people, I'm like, they're sitting in a first class seat on a plane again,
Right?
like every 12 minutes.
Right.
I know they have full time
Highlight
jobs.
reels.
Yeah,
Highlight reels.
I know they have full time jobs. And I kind of assume that unless they won the lottery, then they don't have the money to do that. But maybe they do. I don't know. But you're right. It's this glorification, this romanticizing of a not real existence. And I think it's the kids, of course, but it's also people in their 20s and 30s.
Sure.
And I have to assume, Rachel, that and your field with what you can and kind of talk about, that all the, let's call them young people here in their 20s and 30s who are moving here
Hmm.
because the financial services firm, they're seeing the glamour of moving to South Florida. It's the Palm Beaches. It's nothing but money and sunshine and palm trees. And with that uptick, are you seeing this across the board, more than just kids on social media and young professionals? I'm just kind of curious about that.
So at Hanley, as I said, we start with prevention. We help kids who are in trouble. Maybe they were caught using marijuana. Maybe they were just caught vaping. And for those who develop a substance use disorder, we have a best of the best state-of-the-art treatment center right here in Palm Beach. It sits on 14 acres of botanical gardens. Uh, you know, this is right here in our backyard, and we are seeing an uptick. We have 10 mental health beds in addition to about 100 substance use beds. Those 10 mental health beds are on a wait list all the time.
Oh my.
And many of those patients are young people. And those are young people who, many of them come in and have been experimenting, with drugs, with alcohol, with marijuana, or are just having mental health challenges that are really part of society today, unfortunately.
So you've got the beds for mental health and you've
Mhm.
got 100 beds for substance abuse.
We do.
That's a lot of beds.
It is.
And with the mental health beds with so few,
Mhm.
hopefully you'll expand that and have the chance to do that.
Mhm.
But the 100 beds, are those fully occupied all the time also? I'm assuming it's explosive in nature.
Yes, we have a high trauma program for women. That program again is on a waiting list. This is one of the pilot programs that you were talking about earlier. We just deployed 5 female beds for perinatal women. So women who are either pregnant and addicted, or they've just given birth and they're addicted. We have 20 male beds, again, on a waiting list all the time. We have the best older adult program in the country. Again, on the waiting, there's a wait list all the time. And then we have about 15 beds for a very specialized program for ultra high net worth individuals and
Uh,
those people who are challenged with fame and really need a high level of confidentiality, but also individuality with their programming. So maybe it is a CEO of a Fortune 500 corporation. That is the demographic of somebody in treatment right now. That individual does not have the ability to turn off for 45 to 60 days for treatment. So we curate a program for that individual so that that person can continue to work, but at the same time get the needed addiction treatment.
so it's not strictly then inpatient, if I use the right medical term, where they check in for, they can't do that. I mean, they're running a company or a foundation or
Sure.
something like that. And I love the word curate. It's one of my favorite words in life, by the way, that you've you've put together a special program, special plan. For those who don't think of the word curate,
Mhm.
you create a special program for them because they're a unique individual, which I find fascinating. When I think of centers like this, and I didn't know you were the largest, I had no idea in the country.
Largest continuum for behavioral health in the world. I
I,
mean, nobody else is doing both evidence-based youth prevention programs for kids, family programming, treatment. Um, you know, One of the things you may have heard about that is a new initiative of ours is we have partnered with the Palm Beach County Sheriff's Office, and we are deploying Narcan cabinets all through Palm Beach County at areas of high overdoses. So, parks and libraries and other places where, unfortunately, many people have died
Mhm.
during this opiate epidemic. We have now installed, with the help of the Sheriff's Department, Narcan cabinets. There is not another organization doing all this work. And this is the reason, as you started, that we've been able to take that stigma and start to turn that conversation around so that people understand addiction is a disease. Mental health is something that all of us need to make sure that we are paying attention to.
That's fascinating. You think about large centers. There's the iconic Betty Ford Center. We all heard about Betty Ford
Mhm.
because they attached a celebrity to it,
Sure,
a first lady.
sure.
So you think of Betty Ford and all the celebrities who go
Mhm.
there. But what I love about this is, well, two things. One thing I don't like about it, and one thing I do love is I love that you're the largest and best. What I don't like about it is we need to get the Hanley name out there even more.
Yes,
Because you say
yes,
Betty Ford, we all know what that
yes,
means. We think of Mrs. Ford, and she was a
yes.
lovely person. But to get that word out here locally, what I think that people don't realize in the Palm Beaches is we have these assets, these resources right here
Right
in our
here.
community.
Mhm.
And you talk about the stigma of it. I just think that there's got to be more of a way. And the Palm Beach Chamber is committed, like we were when you had a presentation a year ago talking about Mental
Thank you.
Health Month, so
Yes.
that we want companies to know that if you've got an employee who has an issue, and hopefully you have a good HR director who knows what they're doing,
Mhm.
not
Mhm.
always the case, as we all know,
Mhm.
who can say, "Let me quietly help you do this."
That's right.
Or other ways to Rachel to have us get the name out to the phone number that maybe they just call you, because I'm assuming everything is confidential.
Everything is confidential. I actually have a Betty Ford story.
Tell me.
Hanley Foundation was founded by Mary Jane and Jack Hanley. They were very strong members of the Palm Beach community, and what they did, which was really quite clever, is they made a very large gift to the Palm Beach United Way.
Ah,
And then what they asked is for the Palm Beach United Way and its board of directors and its donors to help build one of the first addiction treatment centers in the country. It opened its doors in 1986,
wow.
and Mary Jane Hanley stood right next to Betty Ford, and they cut the ribbon.
No kidding.
Yes,
Okay, that's
yes.
fascinating. And what inspired the Hanleys to do this? There has to be a backstory there.
There is an incredible backstory. And it seems like the thread that's going to run through this conversation is stigma.
Okay.
And at that time in the early 80s, the stigma it was unbelievable. Jack
Hmm.
was the chair of Monsanto.
Oh
And
my.
yes, Mary Jane found herself in a situation where she had to go to events. She had to have people over for dinner. There was a lot of entertaining. And she found that if she had a glass of wine or two or three, that shy Mary Jane would have been, or would much more easily be able to entertain and feel comfortable in that setting. Well, soon she realized she was an alcoholic. She went to treatment, and then they looked around and said, wait a minute, this treatment saved our family. Why is there not quality treatment in the southeastern United States? So they came down here and they raised the dollars in conjunction with the community and the United Way to build Hanley Center.
There's always something that inspires people to do things like this.
Yep.
And clearly, she was able to tell the story as her passion to make sure that going forward,
Mhm.
other people didn't care. I mean, I always wondered where the money came from, why they had the resource to do this. Not why, but how they had the resource to do
Sure,
this.
sure.
And good people doing good things for the community,
That's right.
which is what
That's
really
right.
needs to happen.
That's
You
right.
have some Go ahead. I'm
I,
sorry.
I was just going to say, and Palm Beach is so amazing when it comes to that philanthropy. So the two programs that we're deploying this year are our program for perinatal women.
Good.
That's the first one. And the second one is what we're calling our Patriots program. So it is comprehensive treatment for veterans and first responders. And what we see a lot is that with PTSD and other trauma, the interventions are only pharmacological. And that's only half the story. That's only one side of the coin. So at Hanley, we have created a program that's comprehensive where, we are doing the other side of the pharmacological. So we are doing the counseling and the therapies that need to align with it so that we can really help get people back to health.
I don't, and this is me personally, I don't understand why there's not more resources for the veterans.
Mm.
I just understand why, with everything we do,
Doug, you're so right.
with our taxes, with our participation in the community, that these women and men who put their lives on the line
Mhm.
come back home. Hopefully, most of them are okay,
Yes,
but a lot are not.
that's right.
And you see the anniversary yesterday of the folks who lost their lives. There was
Mhm.
a service at the Capitol in Washington D.C. I thought, why aren't we taking care of this?
That's right.
I'm grateful. There's a third party. Let's call it a third party provider
Yeah,
with you doing this,
thank you.
but getting the word out to
Mhm.
the veterans and to the first responders, I think, is so very important.
Yes.
And I'm very, very connected with the police department here in Palm Beach and the fire department,
Mhm.
and
Mhm.
those men and women are just amazing.
They are.
They literally, people say, "Oh, it's Palm Beach." No, you never know what they're going to walk into on a daily basis on this island
That's right.
that puts their lives at risk,
That's
and
right.
they're willing to do that because they believe in their
Mhm.
career or the profession. But to get the word out that you do this, I think, is so important. And you use the word pharmacological. You're right. Oh, we'll give them a pill and they'll feel better.
That's right.
Doesn't
That's
happen that
right.
way. Doesn't
It
happen that
does
way.
not.
So those are two new plans. You're deploying this to the veterans.
Mhm.
I love that, by the way.
Mhm.
So other plans for the future for the Hanley
Mhm.
Foundation and the Hanley Center. What are the plans? What do we have going here?
So we have just embarked on an incredible capital campaign,
How much?
and well, we're looking at about $35 million,
Okay.
and it is my hope that those dollars will come quickly so that we can get these buildings built, our campus expanded. One of the things is, as you talked about, we are on a wait list all the time for our mental health beds. We will be doubling the number of mental health beds that we have.
That's huge.
It is huge. We are looking for a lead donor to give us the gift that will help us break ground on that program for veterans and first responders. They will have their own building that is customized to their needs. Same thing with pregnant women. One of the things that's going to be so amazing about this program for pregnant women is we are going to reunify families.
Mm.
So women who have lost older children and they are in the foster care system, once they're in our program, we're going to be able to bring those kids back to live with us on our campus with their moms. And then what we're doing with all young people in our program is we are doing job training, and then our ultimate goal is to get them relaunched back into our community as contributing members of that community.
That's amazing. So it's not just one approach. It's a holistic approach.
It is.
A total approach. Now I
It
have
is.
to believe, and I feel, as somebody like you who's done a lot of fundraising in their life,
Mm,
there's never a better time for you to do this in this community because the amount of vast resource,
yes.
also known as money,
Yes. Yes.
in this town and this region is exponential now.
Mhm, mhm.
And I can think of 3 or 4 people who, if it's their passion, have the capacity to write a check for $35 million if they
Yes.
want to.
Which would be incredible.
If they want to.
Yep. Name our
Yeah,
campus.
name the camp. And where's the campus exactly? I need to know because I don't know where it is for sure.
Well, and Doug, this is one of the things that's so amazing about Hanley. We sit immediately west of St. Mary's Medical Center. So we are, in fact, on St. Mary's campus.
I had no idea.
Yes, yes. So the pregnant women, for example, they will deliver at this incredible high risk program. I think it's called RICIP at St. Mary's Medical Center. So, we have state of the art medical right there. Now, certainly we have our own medical department. We
Sure.
do medical detoxification. We have a full medical and psych department on Hanley's campus, but to be right next to St. Mary's is such an incredible piece of where we are.
45th Street, you can't miss it.
You can't miss
It's
it.
right there. I mean,
Yep.
I have a great fondness in my heart for St. Mary's.
Mhm.
They do an incredible job in the community. And, as a plug for them, their trauma center,
Is incredible.
it's like the best in the southeastern United States as far as I'm
It
concerned.
is.
You
So
know,
is their NICU.
yeah, goodness forbid you get in an accident and a helicopter comes. You want them to
Mhm.
drop you at St. Mary's because
That's
those
right.
women and men in that trauma center are
Mhm.
so on their game. It
Mhm.
blows my mind.
Yes.
I get chills because I know how good they are there.
Well, and
Um,
their administration there, the CEO, I
she's
mean,
amazing.
she is amazing. Don Chester's amazing. I mean, I just can't say enough good things about St. Mary's.
And it's for me that location is just perfect center. It's right there. It's
It's
easy to
right
get
there.
to. It's from the Palm Beach Chamber offices. It's
Mhm.
15 minutes with no traffic and no bridge,
Right.
of course. But it's really so. Rachel, tell me, one of the other things that I want to ask you about very quickly
Sure.
is, Florida is number 3 in human trafficking,
Yes.
which means there are young people or people of all ages who've gotten caught up in that web,
Yes.
who may be pregnant, a pregnant woman
Yes.
with issues, and they might be on substance abuse. That kind of person, if they find you,
Mhm.
what's it cost them to
Mm.
come to you?
Nothing. So today, right now, today, we have in treatment a female human trafficking victim. Um, she was actually trafficked from Pennsylvania. We are not sure how she got down to South Florida. She was arrested on a drug charge, put in jail. And what they realized when they ran her information is that she was somebody who had been reported missing, and up in Pennsylvania. While she was in jail, they realized that she's pregnant.
Mm.
And so, they called us, and she is in our center. She will be with us for the foreseeable future, likely a couple of years by the time we go through job training and everything else. She is with us as part of our Lifesaver Scholarship program.
What is that?
Um,
I love this. I don't know what it is, but I love it.
Yep. So, first of all, I want to give credit to the members of the Palm Beach community. Every year, Hailey Foundation raises somewhere between $500,000 and $1 million for Lifesaver Scholarships.
Mm.
And even though we take insurance and we take the veterans insurance and all the rest of it, our board of directors has said we have a number of beds that are carved out that we hold aside for individuals who can't pay anything and they are on scholarship.
Wow.
The other thing that we're able to do is scholarship people who are unable to meet their deductible or they're out of pocket. Now, certainly they have to apply for those funds, but
Sure.
you know how insurance deductibles can be. They are very, very high. And that could be the difference between somebody getting treatment and not getting treatment. But this human trafficking victim, she's with us right now, and it's a complex case.
Sure.
But she is in the right place, and we are thrilled.
I mean, so her getting arrested saved her life.
It did. It did.
And to me, you think about getting arrested as the worst thing that could happen. In this case,
It was the
this
best.
woman saved her life.
Mhm.
That the police department or whoever arrested her,
Mhm.
had the thought or the connection to call you folks and say, "Can you help? We got a problem here."
Yeah. So it's actually better than that.
Tell me
It's
more.
better. When they arrested her and realized that she was a trafficking victim, they called her family back in Pennsylvania who was still looking for her. I mean, it's truly what you see on TV where there are signs on
Milk cartons.
yes,
Yeah,
and
right? The
light
old days.
posts and so what ended up happening is the family did, their research, and every place they called said the only center that's going to be able to really help her is Hailey. So they called and we said, absolutely, bring her in.
I hope in a situation like this, and we won't belabor this, I hope in a situation like this for a person who is saved, that through the process, for whatever deal they cut, that it appears to me that this was not her fault. None of this was her fault. Somehow
Right.
she got taken into this web of madness, the drugs, getting arrested.
Mhm.
Hopefully, I'm hoping the charges get dropped. She's with you. She stays with you for
Mhm.
2 years,
Mhm.
has the child, has a perfect life, and
That's
comes out
right.
and says, I'm saved.
Yeah.
Thank goodness for the Hanley Center. Then I hope she becomes a CEO, makes $1 billion, and
Yeah,
gives it all back to
me
you.
too. Me too.
That's what I want right there.
I do need a billionaire
Yeah,
to give us
well,
a $1 billion.
there's like
So
lots of them here on the island of Palm Beach and
yes,
West Palm Beach also.
yes,
So,
yes, yes.
Rachel, how do people get a hold of you? What's the simplest way? And if
Mhm.
they call you, if they say it's anonymous, I'm assuming
Sure,
that your people, when they answer the phone, they know what to do.
sure,
And they
sure.
know how to talk to people in a nice way so they don't panic and get scared. Because I would think, Rachel, somebody taking that first step
Mhm.
to recognize this takes a lot of courage
It does. It
to make
does.
that phone call.
It does. I'd give you the number, but the easiest thing to tell people to do is just plug Hailey Foundation right into your smartphone. The number will pull up right there, so nobody has to remember anything. Just push call, and it will take you right into our call center. Here's another thing I should say. If people have questions, just call us. The individuals who answer our phones are trained to answer questions about mental health. They're trained to answer questions about substance use disorders. And if we can't help you, it is our mandate to make sure that we get somebody to where they need to be. We have folks call us from around the country all the time, and we help them find quality treatment right there in their communities. That's part of what we do.
You refer.
We do. We do. And it's the right thing to do. We are not worried about making a zillion dollars. What we're really, really focused on is making sure that every individual gets the treatment they need, and we heal families. We do it all the time. And, it's just the best feeling in the world.
And if somebody calls,
Yeah.
it's confidential.
Everything is
And
confidential.
the person on that phone, if they recognize the person in either from outside of the community, that's like they know the name they've seen in the newspapers or here locally,
Mhm.
they're not going to tell anybody.
No.
They're not going to
No.
report it.
Nope.
They're just going to take
Nope.
it into the system and go to whoever they report to
Yes.
and start the process.
Yes. And, that's an important thing for me to say to you. If a pregnant woman comes to us who is using drugs or alcohol, they're safe. There is no reporting. They are not going to be reported to the Department of Children and Families. They're not going to be reported to the police or anybody else. We have those agreements in place so that as the woman is with us and in this program, she's safe. She's safe. She's doing the right thing. She's getting help for herself, for her future child, and she is safe.
I've loved this conversation. And, out of all the chamber members, I love all my members, by the way, something tipped in me when I heard about what the Hanley does a year ago at one of our breakfasts. And you can talk to, Turner,
Yeah,
who's on
Turner
your team.
Benoit is just an amazing
Yeah,
member of
I'm
our
s-
team.
I'm so committed to getting the word out about you folks because
Thank
I
you.
see this explosion, this exponential explosion of need in this community.
Yeah.
And it's going to get worse
Mhm.
before it gets better. But we are so fortunate to have the Hanley Foundation, the Hanley Center here in this community. I didn't realize it was the largest in the United States. I didn't realize what you do. I knew a lot. I mean, the Suicide Prevention Month was the thing that tipped me like, yeah,
Mhm.
because people after the holidays, they get upset and they think about these things. And
Yes.
I fully believe, and I really want to push because January's right around the corner again.
That's right.
I
That's
want
right.
I want the Hanley Foundation to push on our membership list to the corporations, the HR people saying, hey, it's
That's
coming
right.
up. You need to know HR directors. And I'm committed to connecting you with one of our members who is in the
I
HR
would love
field
that.
to have her get the list, get the word out because it's very, very important. So Rachel Docekal, got it right.
Yeah, got it
Dr.
right.
Rachel Docekal, who's
That's right.
her return journey to the Hanley Foundation, Hanley Center, who's going to take it to the next level. Thank you for
Thank
coming in
you.
today.
Thanks for having me.
it-
And I love your jacket.
Oh, thank you. Well, it's not the holidays, but it's Palm Beach
It
Palm
is
Beach
the
colors.
best.
So
Palm Beach chic.
Palm Beach Chic, thank you so much. You've been listening to Your Palm Beach Guide, a program of the Palm Beach Chamber of Commerce. Tune in wherever you get your podcasts. I do all the time. Hopefully, you'll find some information in this that's helpful to you, helpful to your friends, your family, your community. Rachel, you're always welcome, and thank you for being a part of our
Thanks,
community.
Doug. All
Make
right.
it a great day.
Thanks, everyone. Bye-bye.